There are moments when the body whispers that something isn't right, and then there are moments when it stops whispering and starts demanding your attention. The kind of moments that arrive quietly but refuse to be ignored. The kind that sit with you late at night when everything else is silent and your thoughts begin to spiral, because deep down you know this doesn't feel normal. And what scares you most isn't the discomfort itself, but the question you're too afraid to ask out loud. What if? This is something serious? Many people brush off early warning signs, telling themselves it will pass, convincing themselves they're overreacting. But the truth is that some conditions don't announce themselves loudly at first. They creep in, blending into daily life until one day you realize your focus is gone, your patience is thin, your sleep is broken, and your body feels like it's fighting a battle you didn't agree to join. That unsettling combination of internal distress and growing unease has a way of making everything feel urgent, because suddenly you're not just dealing with discomfort, you're dealing with uncertainty, and uncertainty can be terrifying. You start replaying the past few days or weeks in your mind, wondering when it began, wondering why you didn't pay attention sooner, wondering if ignoring it might come back to haunt you. The fear isn't just about how you feel right now. It's about what might be happening beneath the surface, out of sight, quietly progressing while you go about your life. This is the kind of situation that makes even the strongest people anxious, because it challenges the sense of control we like to believe we have over our own bodies. When something feels off in such a personal, intimate way, it can shake your confidence, your focus, even your mood, leaving you restless and searching for answers at odd hours of the night. You might find yourself scrolling endlessly, hoping for reassurance, but stumbling instead on stories that make your heart beat faster, stories that make you wonder if what you're experiencing is a warning sign you shouldn't ignore. There's a particular kind of fear that comes from not knowing whether your body is asking for help or sounding an alarm, and that fear grows heavier the longer you wait. It can make you question your judgment, your resilience, and your instincts, especially when others around you don't see what you're feeling and tell you it's probably nothing. But deep inside, there's that persistent voice reminding you that your body is trying to tell you something, and that ignoring it may not be the safest choice. Conditions that involve both internal strain and localized distress have a way of blurring the line between temporary issue and serious concern, and that gray area is where anxiety thrives. This is why understanding what could be behind such a situation matters so much, because awareness is often the first step toward regaining a sense of control. If you've ever felt that mix of worry, confusion, and urgency, if you've ever wondered whether what you're experiencing is more than just a passing problem, then it's important to keep listening, to keep learning, and to stay with this conversation, because what you don't know yet could be far more important than you realize. When we talk about this condition, we are talking about a situation where the body and the mouth are clearly connected, even though many people don't realize it at first. Fever with dental pain is not just about a sore tooth or feeling a little warm. It is the body's way of signaling that something deeper may be happening and that the immune system has been activated. A fever means your body is fighting something it believes does not belong there. And when that fever appears alongside pain in the teeth or jaw area, it often points to a problem that has moved beyond a simple local irritation. Inside the mouth, teeth are not isolated objects. They are connected to nerves, blood vessels, and surrounding tissues, all of which communicate with the rest of the body. When an issue develops in or around a tooth and begins to stress these connections, the body may respond with a general reaction, raising the temperature as part of its defense. This is why this combination can feel so intense and draining, because you are not only dealing with discomfort in a very sensitive area, but also with the full body response that comes with a fever. Many people are surprised by how quickly this situation can affect their energy, mood, and ability to think clearly, because fever alone can cause weakness and mental fog, and dental pain alone can be sharp, throbbing, or exhausting. When they appear together, they can amplify each other, making even simple daily tasks feel overwhelming. What makes this condition especially concerning is that it can blur the line between a minor issue and a more serious one, leaving people unsure of how worried they should be. Some may try to push through the pain, hoping it will settle on its own, while others may feel a growing sense of alarm because the body's signals feel stronger than usual. From a medical point of view, This combination tells us that the body is not ignoring the problem. It is actively reacting to it. That reaction can show up as chills, fatigue, and a general feeling of being unwell, alongside the localized pain that keeps pulling your attention back to your mouth. It can also affect sleep, appetite, and concentration, which further weakens the body and increases emotional stress. Understanding what this condition represents is important because it reminds us that oral health is not separate from overall health. The mouth is an entry point to the body, and problems there can have effects far beyond chewing or smiling. When fever and dental pain appear together, it is often a sign that the issue has reached a point where the body feels the need to respond more strongly. This does not mean panic, but it does mean awareness. It means listening closely to what your body is telling you instead of brushing it aside. If you are experiencing this, you are not weak, and you are not overreacting. Your body is asking for attention and care. Staying informed, staying alert, and taking your health seriously is an act of self-respect. And if this explanation resonates with you, I gently encourage you to keep listening and take the next steps toward clarity and relief, because your well-being truly matters. When we talk about what causes this kind of condition, it helps to understand that the mouth is a very sensitive and complex area, and when something goes wrong there, the rest of the body often reacts. One common reason this combination appears is when a problem inside a tooth goes deeper than the surface and reaches the inner parts where nerves and blood vessels live. At that point, the body may recognize it as a serious threat and respond with a fever as part of its defense system. Another cause can be an issue in the tissues around the tooth, such as the gums or the bone that supports the teeth, where irritation or infection can slowly build up and then suddenly overwhelm the body's ability to keep it contained. Sometimes, what starts as a small, unnoticed problem can grow quietly over time until the body is forced to react more strongly. There are also situations where dental pain and fever are connected to problems around the jaw or face, where swelling and pressure can affect nearby structures and trigger a full-body response. In some cases, recent dental work or trauma to the mouth can open a pathway for bacteria to enter areas they normally wouldn't reach, leading the immune system to raise the body temperature in response. Poor oral hygiene over long periods can also play a role, not as a single cause, but as a factor that allows small issues to grow into bigger ones. It's important to remember that the mouth is constantly exposed to bacteria, and while most of the time the body keeps things in balance, that balance can be disrupted by stress, exhaustion, weakened immunity, or other health conditions that make it harder for the body to fight back. Sometimes people notice that their dental pain seems worse when they are already feeling run down, and that is not a coincidence. The body's defenses are closely connected. There are also cases where pain in the teeth is not coming from the teeth themselves, but from nearby areas such as the sinuses, which sit very close to the upper teeth. When those areas become inflamed or infected, they can create pressure and discomfort that feels like tooth pain, along with a fever that makes the whole situation feel much worse. What all these causes have in common is that they push the body beyond a simple, local reaction and into a more general state of alert. The fever is not random. It is a signal that the body is actively fighting something it cannot ignore. This is why it's so important not to dismiss this combination as just bad luck or a temporary inconvenience. Understanding the possible reasons helps remove some of the fear of the unknown and replaces it with awareness. If you recognize yourself in this explanation, I want you to know that paying attention now is an act of care for yourself, and seeking proper guidance can make a real difference. You deserve clarity, comfort, and peace of mind. And taking the next step toward understanding what's happening in your body is a gentle but powerful way to protect your health. When this condition begins to show itself, the body often sends signals that are hard to ignore, even if they start subtly. Many people first notice a general feeling of being unwell, a kind of heaviness or fatigue that doesn't quite make sense, as if your energy has been quietly drained. Along with that, the rise in body temperature can bring warmth, chills, or sweating, sometimes all at once, making it difficult to feel comfortable no matter what you do. The fever may come and go or steadily climb, and with it can come headaches, body aches, and a sense of mental fog that makes it harder to focus or think clearly. At the same time, the discomfort in the mouth often demands attention. Dental pain in this situation is rarely mild. It may feel like a deep, throbbing ache that pulses with your heartbeat, or a sharp, stabbing sensation that flares when you bite down, chew, or even touch the area with your tongue. Some people describe it as pressure that feels like it's building from the inside, while others notice pain spreading toward the jaw, ear, or even the side of the head, making it difficult to tell exactly where it's coming from. The area around the painful tooth may feel tender, swollen, or sensitive to hot and cold, and this sensitivity can linger long after the stimulus is gone. As these symptoms continue, everyday activities like eating, drinking, and speaking may become uncomfortable or exhausting, adding to the emotional strain of feeling unwell. Sleep is often affected too, because fever can disrupt normal rest, and dental pain has a way of worsening at night when distractions are gone. You might find yourself waking up repeatedly, unable to get comfortable, your mind racing as you wonder why your body feels like it's fighting against you. Appetite may decrease, not only because of pain when chewing, but also because fever can dull hunger, leading to weakness that feeds back into the cycle of feeling unwell. Some people also notice changes in their mouth, such as a bad taste that won't go away or a feeling of fullness or tightness in the gums or jaw. Emotionally, these symptoms can take a toll, creating anxiety, irritability, or even fear, especially if they seem to be getting worse rather than better. It's common to question yourself, to wonder if you're imagining things or being overly sensitive. But the combination of whole-body symptoms with focused dental pain is the body's way of asking to be taken seriously. Everyone experiences this a little differently, but what matters is how persistent and disruptive these signs can become. If you recognize these experiences in yourself, I want you to know that listening to your body is not a weakness, it's wisdom. You deserve relief, understanding, and care. And taking a moment to acknowledge what you're feeling and seek proper guidance can be the first step toward feeling safe and well again. So please stay attentive to your body and don't hesitate to reach out for the support you deserve. When it comes to preventing this kind of condition, the most important idea I want you to hold on to is that small, consistent care can protect you from a lot of pain and worry later on. Prevention here is not about doing anything extreme or complicated, but about respecting the connection between your mouth and the rest of your body. Everyday oral care plays a powerful role because keeping the teeth and gums clean reduces the chance that small, hidden problems will quietly grow into something that affects your whole system. Paying attention to your mouth on a daily basis, noticing changes instead of ignoring them, and responding early when something feels off can make a real difference. Regular checkups are not just about fixing problems. They are about catching things before they become overwhelming, and many serious issues begin silently long before pain or fever ever appear. Beyond oral care, supporting your overall health matters more than many people realize. A body that is rested, well-nourished, and supported by a strong immune system is better equipped to keep minor issues from turning into major ones. When you are constantly exhausted, under stress, or not eating well, the body's defenses weaken, and that makes it easier for problems in the mouth to spread or worsen. Staying hydrated helps too, because a healthy flow of saliva naturally cleans the mouth and helps control bacteria. Being gentle with your teeth also matters. Avoiding habits that put unnecessary pressure or cause tiny injuries that can open the door to trouble later. If you ever have dental work done, following aftercare instructions carefully is another quiet but powerful form of prevention, because it gives your body the best chance to heal properly without complications. It's also important to take any discomfort in your mouth seriously, even if it seems small at first. Pain, sensitivity, or swelling are not things to push through or normalize. They're messages. Acting early, asking questions, and seeking advice when something doesn't feel right can prevent a simple issue from turning into a condition that affects your whole body. Prevention also includes listening to patterns, noticing if discomfort keeps returning to the same area or if you tend to feel run down when dental issues appear, and addressing those patterns with care rather than frustration. None of this is about fear, it's about empowerment. When you understand that your daily choices and awareness truly matter, you regain a sense of control over your health. You are not helpless in this process, and you don't need to be perfect, just attentive and kind to your body. If you take anything from this, let it be this gentle reminder that caring for yourself consistently is one of the strongest forms of protection you have. Your body works hard for you every day, and when you support it in return, you create space for comfort, confidence, and peace of mind. If this message speaks to you, I encourage you to keep learning, keep listening to your body, and take those small, steady steps that help you feel safe and well, because you truly deserve to live without unnecessary pain or worry. When it comes to caring for this condition, the most important thing I want you to hear is that relief is possible, and you do not have to endure this alone. Treatment always begins with taking the situation seriously and allowing a trained professional to look at the full picture, not just the pain in your mouth or the fever in your body, but how they are connected. Once the source is identified, care is focused on calming the body's response while addressing what is happening in the mouth. Reducing fever helps the body regain strength and comfort, allowing you to rest, think clearly, and begin to recover, while easing dental pain helps you eat, sleep, and speak without constant distress. Often, treatment involves carefully removing the source of irritation or infection in the tooth or surrounding tissues, which may sound frightening at first, but is usually the step that brings the greatest sense of relief. Many patients describe feeling a surprising emotional release once the pressure and pain begin to ease, because the body finally stops being on constant alert. Supporting the body during this time is just as important as treating the mouth itself. Rest allows your immune system to do its work, hydration supports healing, and gentle nourishment helps rebuild strength that may have been lost during days of discomfort and fever. Pain relief measures are chosen thoughtfully to keep you comfortable without masking important signals your body is still sending. In some cases, additional care may be needed to help the body fully clear what it has been fighting, and this is done carefully, with close attention to how you respond. What matters most is that treatment is not just about fixing a problem, but about restoring balance and helping you feel like yourself again. It is also a time for reassurance, for understanding what happened, and for learning how to protect yourself moving forward, so the same situation does not repeat. Many people feel embarrassed or guilty for not acting sooner, but there is no place for blame here. Bodies are complex, life is busy, and pain does not always follow clear rules. What matters is that you choose to care for yourself now. Healing often happens in stages, with steady improvement rather than instant change, and that is normal. As the fever settles and the pain fades, energy slowly returns, sleep improves, and the constant worry begins to loosen its grip. This is a process, and patience with yourself is part of the treatment too. If you are going through this, I want you to remember that seeking help is a sign of strength, not weakness. Your comfort, safety, and peace of mind are worth protecting. If this explanation has helped you feel a little more grounded or hopeful, I gently encourage you to take the next caring step, listen to your body, and reach out for proper support, because you deserve to feel well, secure, and confident in your own health again. As we come to the end of this conversation, I want you to take a quiet moment and simply check in with yourself, because your body has been trying to communicate with you, and listening is an act of care, not fear. If anything you've heard today feels familiar, or if it has gently stirred concern or recognition, please know that this is not meant to alarm you, but to support you. Health information should never make you feel alone or overwhelmed. It should help you feel understood, empowered, and a little more steady on your feet. Many people carry discomfort longer than they should, telling themselves they are too busy, that it will pass, or that others have it worse. But your experience matters, and your well-being is not something to postpone. You deserve to feel comfortable in your own body, to sleep without pain, to eat without worry, and to move through your days without that constant background stress of something being wrong. Taking the next step does not have to be dramatic or frightening. Sometimes it's as simple as making an appointment, asking a question, or deciding that you are worth the time and attention it takes to feel better. If you are feeling uncertain, that's okay. Uncertainty is often the place where healing begins, because it pushes us to seek clarity instead of continuing in silence. I want you to remember that support exists, answers exist, and relief is not out of reach. You do not need to diagnose yourself or carry this alone. Trusting a professional, allowing yourself to be cared for, and choosing to act gently but deliberately can change the entire course of what you're experiencing. Even if everything turns out to be less serious than you feared, the peace of mind you gain is valuable. And if something does need attention, addressing it sooner rather than later can protect not just your health, but your confidence and sense of control. Please be kind to yourself in this process. Healing is not just physical, it's emotional too, and reassurance is part of that healing. If this video helped you feel seen, informed, or even just a little less anxious, I encourage you to stay curious, stay aware, and take that next small step toward care. And if you think someone you love might be quietly dealing with something similar, sharing this message could help them feel less alone as well. Thank you for taking the time to listen, and more importantly, thank you for choosing to care about your health. Your body has been carrying you every day of your life, and it deserves your attention.